So you start talking about epics in healthcare. Let's start there and let's kick off the conversation there and bring the listeners up to speed on what you're talking about in terms of the 50-year epics within healthcare.
There is such great research in business and disruption. And most of the research shows that these industries have roughly 50-year cycles, meaning each 50 years, something really disruptive happens and they're enabling laws or technologies or other events that set it up. And so if we look in healthcare, going back to the 1870s, that was public health, the biggest drop in mortality that's ever been seen in healthcare. And the enabling factors were Lister and Pasteur and the germ theory. And looking back on it, it was obvious. Back in the 1920s, we saw medicine that was actually effective. Discovery of penicillin and other efforts led to healthcare that really worked. In the 1970s, we saw a transition to evidence-based medicine. Randomized controlled trials came to the fore. It was because of Nazi Germany, Helsinki Declaration, Nuremberg trials, Beecher Report, a series of events that said, listen, we need to get our act in order for research and use research to enable medicine as a science. Since the 1970s, there have been a lot of changes. And we look into the 2020s here and we say, okay, what are the disruptions that are about to happen? What are the enablers? And what we're seeing is from the 1970s, when most patients were relatively healthy and most people had one disease at most, we have transitioned to a time when people are living longer, people are living with multiple comorbidities. That's a change. Another change is back in the 1970s when most diseases had one or two treatments. Now we look in the 2020s and there are tons of treatments available for most conditions. In that situation, the question is, how are doctors choosing for a patient who has multiple comorbidities and there are multiple treatment options available? And what's happened is they don't have good information. The randomized trials can never look at subgroups, are not doing much comparative effectiveness. And that's needed now with people having multiple comorbidities and multiple treatments available. And so there's a desire to tailor therapy. What's happening is doctors are making guesses. We've gone from medicine as a science 40 and 50 years ago to medicine as an art again. And that's not where we want to be in healthcare. So as we look to the 2020s, we have enabling technologies, we have compute power, we have artificial intelligence, we have data in the system through electronic health records. We have so much that's enabling, and we have a desperate need for tailored therapy, which we sometimes call personalized medicine or data-driven healthcare or precision health. We have a desperate need. We call it real-world evidence. So many names for the same thing. Subgroup analytics, comparative effectiveness, and tailored therapy. And that's the disruption we see starting in the 2020s and probably getting better and better over the next 50 years.